Welcome everyone to our Lunch and Learn session. This is an introduction to global health and social accountability. Grab yourself some pizza and sit down if you haven't had any. And wow, we might actually go through it all. There may not be leftovers, so one serving. There you go. My name is Manisha Kulkarni. I'm the Assistant Dean of Global Health in the Faculty of Medicine, professor in the School of Epidemiology and Public Health. I'm here today with colleagues from the International and Global Health Office and the Office of Social Accountability. And we'll be talking to you a bit about what is global health, what is social accountability, and then a bit more of a deep dive into our concentration in global health and social accountability. So before we get started, I'd like to pay respect to the Algonquin people who are the traditional guardians of this land. And we acknowledge their long-standing relationship with this territory, which remains unceded. A bit about our International and Global Health Office, or IGO, and here's the outline of what we'll be talking about today. So I'll be speaking about what is global health. Dr. Kendall, the Associate Dean of Social Accountability, is online and will be talking to us about what is social accountability. Dr. Alison Krentel, who's a professor in the School of Epidemiology and Public Health, is here, and we'll be talking a bit more about what does decolonizing global health mean. And then Leah Elkor, our coordinator for global health in IGO, will talk about the concentration. So as you may have heard, IGO, or the International and Global Health Office, promotes internationalization at the Faculty of Medicine, as well as the sustainability of international partnerships and the global health program. So this is done through these four key areas of ensuring impactful and diverse partnerships, improving global health locally and abroad, prioritizing our social accountability mandate, and empowering our learners for global citizenship. Our team were led by Vice Dean Dr. Mark Walker and myself, the Assistant Dean, and contact details are here for Leah as well. And you can find our website with a lot more details on the different programs and activities. Quick note about the Office of Social Accountability. The Office of Social Accountability oversees programs and activities addressing populations living in vulnerable circumstances in Canada. Given the synergies between the mandates, the IGO and Office of Social Accountability collaborate on several initiatives, and faculty learners can explore both their global health and social accountability interests in the concentration of social accountability and global health. So what is global health? Now, many of you may have some background in terms of your degrees that you've been doing. You may have studied global health. You may have taken part in global health activities. But it's important to understand from the context of our Faculty of Medicine is when we say global health, what are we really talking about? And the starting point, of course, is how do we define health? And health is really defined as a state of complete physical, mental, and social well-being, not merely the absence of disease or infirmity. We can also think about public health as the science and art of preventing disease, prolonging life, and promoting health through the organized efforts and informed choices of society, organizations, public and private communities, and individuals. And population health, which is an approach to health that aims to improve the health of the entire population and to reduce health inequities. So that's really one of the keys here, reducing health inequities among population groups. And in order to reach these objectives, it looks at and acts upon the broad range of factors and conditions that have a strong influence on our health. So looking at the determinants of health, social determinants and ecological determinants of health. Global health, and this is a definition from a Canadian academic, is said to have arisen from the spaces where population and public health, health promotion, and international development converge. But that definition has really expanded and broadened since 2011 when this was put out there. So in terms of where did global health come from? So global health in an academic sense is a relatively new field. It has emerged from the spaces where initially tropical medicine and international health had emerged. Tropical medicine, and we'll hear a bit more about this, when Dr. Krentel speaks, was really focused on serving populations, colonial populations that had gone into tropical countries and were coming down with different diseases. And there was a need to find treatments and preventive measures to address these new tropical conditions. So it's rooted in colonialism. There was a lot of capacity development that did happen during this period and the establishment of institutes of tropical medicine in many low middle income countries and disease endemic nations. But the focus was really on higher income countries helping out or providing assistance into low income regions where some of these diseases persisted. And this type of attitude and focus also transitioned into what we call international health, which again was focused really on higher income countries, providing assistance or helping out in technical expertise or funding to lower income, lower resourced regions in order to help to solve some of the problems that were happening in these regions. Less so on equal partnerships between researchers and practitioners in the different countries. Global health has really come from these more colonial focused roots and emerged to be focused more on reducing inequities, recognizing the power and privilege that populations in higher income countries have. There's some folks at the door. And trying to set the type of work we're doing to address global issues on a more equal playing field. And so we'll be talking a bit more about what that looks like and how, as students, researchers, practitioners based in Ottawa, but people that have come from all parts of the world, we can help to engage in global health in a way that recognizes the dynamics that exist between higher income and lower income or lower resourced regions of the world, and to act upon the issues in a respectful way that doesn't exacerbate some of these inequities. So the origin of global health, as we mentioned, so tropical medicine and international health were rooted in some of these more international assistance type of mechanisms. Global health has not emerged as a discipline that corresponds directly to a set of skills. So it actually encompasses a very broad range of skills. It reflects a greater international connectedness that leads to increased opportunities to work overseas and the increasing interest and demand of kind of young professionals to work in this field. It reflects more awareness of common vulnerabilities that lead to the spread of communicable and non-communicable diseases that necessitate national and international strategies to prevent them. The common forces of globalization and global change, including climate change, that are driving these emergence of new health issues on a global scale, regardless of place. It reflects discomfort that there are huge inequalities in disease burden between rich and poor countries and between rich and poor people anywhere, within Canada, within any country, as well as interest from the wider spectrum of professions outside of the health-related fields. So we have interest from agriculture, economics, veterinary medicine, the environmental sciences, the biomedical and basic sciences. So outside of the traditional health-related fields, as well as recognition that we need to have two-way knowledge sharing between high-income country and low- and middle-income country partners to effectively address these emerging global health issues. So it's not a one-way transfer of knowledge and resources, it's a two-way knowledge sharing and co-creation of solutions. And there's also been this really big shift towards population health approaches in addition to traditional kind of public health approaches. And this embraces the breadth of important health threats, but also the broad determinants of health. Global health, and this is how CIHR, the Canadian Institute of Health Research, kind of categorizes the main features of global health, is that it's transnational, so it addresses health issues and determinants that transcend national boundaries. It's focusing on health equity for all, with a focus on global socioeconomic, environmental, and cultural factors that determine health. And it's very collaborative, or requires collective action, recognizing the critical importance of collaboration across countries, sectors, and disciplines. So this is a common definition that was put forward, that global health is an area for study, research, and practice that places a priority on improving health and achieving equity in health for all people worldwide. It emphasizes transnational health issues, determinants, and solutions, involves many disciplines within and beyond the health sciences, and promotes interdisciplinary collaboration, and its synthesis of population-based prevention with individual-level clinical care. So you could say, well, that kind of sounds like everything. It's doing a lot. So, you know, where are the boundaries of global health? And I think, you know, as people working in the global health space, we can say that those boundaries are constantly shifting, right? There's a large discourse that's ongoing, especially over the last few years, in terms of how can we really define and redefine global health to make sure that it engages everyone. So I'm not going to go into this in more detail. I think the slides will be accessible and the recording of this will be accessible. But just to say that, you know, comparing global health versus international health versus public health, we can say that there's a lot of overlap and there's a lot of similarity. But there are some specifics to global health in terms of its really focusing on health issues that transcend boundaries, so transnational issues that occur across boundaries, requiring global cooperation for many of these issues. So it's not just taking place in one particular part of one country. Embracing both prevention in populations and clinical care of individuals. And I think this is an important and unique part of global health in that it does cross-cut medicine and public health. Involving health equity among nations and for all people is a major objective. And of course, it's highly interdisciplinary and multidisciplinary within and beyond the health sciences. So now we have a better idea of what global health means. What does it mean to be a global health researcher or practitioner? And I'm assuming if you're here today, you might be interested one day in being a global health researcher or practitioner or incorporating some global health elements into your studies. So some of the facets that we focus on in IGO, but as well in CEF, in our global health stream and different courses, are the different domains and competencies that have been defined for global health education. So these are defined by the Consortium of Universities for Global Health, and we're in the process actually of kind of updating our curriculum in global health, focusing on many of these domains and many new emerging ones as well. So you can see that it's not just looking at kind of the content of what's the global burden of disease and how does you know, health, public health and healthcare operate in different countries. We're really looking at capacity strengthening, ethics, professional practice, all of these different, what would previously be called soft skills, are really important in global health. So in terms of the competencies you need, I think this is a really nice statement again by Donald Cole, saying that in global health, we require knowledge and skills regarding north-south power dynamics, linkages between local and global health problems, and the roles of international organizations. We must be able to work responsibly in low resource settings, foster self-determination in a world rife with power differentials, and engage in dialogue with stakeholders globally. So we need skills in cross-cultural communication and the ability to critically self-reflect on one's own social location within the global context. So our global health program at the Faculty of Medicine aims to promote health and health equity, particularly with institutions in low and middle income countries, emphasizing reciprocity and shared benefits through all of these different areas. And we have objectives that relate to building partnerships that are impactful, but also equitable, and that adhere to the Brochet Declaration principles. And I'm not sure, Alison, if you'll talk specifically about the Brochet Declaration, but again, it's a set of equitable principles for global health partnership that we have signed on to as a faculty. In education, we contribute to global health strategies within the Faculty of Medicine and support experiential learning opportunities, collaborating with the Office of Social Accountability and the different departments, including the School of Epi and Public Health, which has a strong global health curriculum. And in terms of knowledge exchange, the Global Health Program acts as a global health hub, facilitating the exchange of ideas and collaborative activities. We have international partnerships. So these are institutional partnerships that the Faculty of Medicine has in Tanzania, in Benin, and in Guyana. But there are also many, many other partnerships that individual faculty members have and that have been engaged in international and global health activities for many different years. These are the ones where we have kind of institution to institution collaboration across a number of different programmatic pillars. So I'm going to hand it over now to Dr. Claire Kendall, the Associate Dean of Social Accountability, and Christine Matthews, the Program Manager of the Office of Social Accountability, to talk a bit more about what is social accountability.
Thanks. I'm sorry I can't be with you. My boss's summoned me to something that I can't be late for, so I'm sorry to be presenting virtually. I can't see, I can only see the backs of you, so I can't tell those students who I might have crossed paths with before. So as Dr. Kulkarni mentioned, I'm the Associate Dean Social Accountability, and I think she shared a little bit about what that means for our office. So we'll go through our slides. I can see, I think the first one is up, right? Oh my goodness, they're so small. I can't even see them. How are you going to guide me? Goodness. Give me 1 sec. I think I can switch views so I can actually see them a bit better. I can. Perfect. Awesome. All right. So social accountability is something that we're actually accredited on as a Faculty of Medicine, and it's the obligation to direct the medical school's education, research, and service activities towards addressing the priority health concerns of the community, region, or nation we have a mandate to serve. So that's a WHO sort of statement around social accountability. We in our office internalize this through 3 distinct pillars. The first is that we really want to foster the partnerships we need to identify and address the priority health needs of our community. So that's like hearing from them about what those are. We have a goal to graduate the next generation of socially accountable health professionals and researchers, not only physicians. Oh, sorry, there's been like a swap of some of our things here, and to conduct research for social impact. We'll go to the next slide. And there's something called the social obligation gradient. I'm just going to speak to it briefly because I think it kind of helps to embody what we're trying to do here in the faculty. So if we go to the next slide, you'll see there's this concept of social responsibility, and you see that happening, you know, in different corporations and things. But really what it means is that we're aware that we should be responding to society's needs. So we know we should be, you know, addressing certain issues that are important in our community. It's sort of like more like what we know. And if we go to the next slide, you'll see that the next is the concept of social responsiveness, which is more what we do. So we identify and priority community health needs, and we try and address these through our activities. But social accountability really gets to the way we do this, and that's by working with stakeholders and communities and other partners to improve health status in our communities and to strengthen health systems. So hopefully that's something that has resonance to many of you in the room, and that we think about how well we're doing along the way. We can go to the next slide. We're going to highlight a few of the social accountability concentration activities that we have available through the concentration program. And these tend to evolve a bit just because of the nature of partnerships, actually. So, you know, while we'd like to have things starting at certain times, you know, per our academic calendars, sometimes we need to be reflecting on the needs of the people and partnerships we're working with. So we'll go to the next slide. One is called the Empathy Project. I don't know, is anyone in the room, did anyone in the room do the Empathy Project this last couple weeks among the medical students? I think I see hands, and you may have participated in it in the past. So this is an interprofessional experiential learning activity that we conduct in collaboration with the Alliance to End Homelessness Ottawa, and it sort of simulates the day in the life of someone seeking to address core health and social service needs. So it's quite a detailed activity. We've already conducted it for the medical students this year. But what we're hoping to do is that if there are concentration students who are interested and haven't participated in their own spheres, because it was medical students and pharmacy this year, that we'll be able to include a small number of people next year. So you can reach out to us and ask us more about that if you'd like. Another space to work in is what are called the City Studio Ottawa projects. And we can go to the next slide. I'll tell you a little bit more about City Studio Ottawa. I think one more. Actually, so City Studio Ottawa is a partnership, fairly new, only in the last couple of years, started in the Faculty of Medicine. And it's a partnership between the City of Ottawa, University of Ottawa, Carleton University, and Algonquin. And what the purpose of City Studio is to address the priorities in our community. As we've said, like that's an important mandate for our office. And we have a vision to work together with all these partners for a more inclusive, sustainable, and healthier city. And our mission is really to inspire, connect, and mobilize students, the faculty, the city, and community members to collaborate on action to build a thriving Ottawa. So go to the next slide. These are the priorities that the City Studio Ottawa projects address. So we get these ideas from the city. They don't come from us. They're not meant for us to say we know what's to be done best. They come from the city through what's called the Ottawa's Community Safety and Wellbeing Plan, which are priorities that you can see on the slide that have been outlined through community collaboration around where we think we need to move the needle on genuine health and well-being in our region. So from a holistic perspective. As well, last year we added the City of Ottawa term of council priorities, which have quite a lot of overlap actually with the CSWBP. And you can see, but they kind of stretches more into the areas of sustainability and economy. Okay, we can go to the next slide, I think. This is the way the City Studio cycle works. So this will help also explain to you why, we don't necessarily have projects sitting waiting. We do an event called an Idea Jam at the beginning, like the term before we want to have projects. So the last one would have been in June, and we have another one coming up, which will be for the winter term. This is where city staff come together to brainstorm ideas for collaboration around those priorities. Then we go through quite a complex process actually of matching these projects to courses or to opportunities like this. So right now we're just in the process of trying to scope out a few projects that have come from the city, make sure that they're reasonable, make sure we've got, there's a reasonable time amount that a student or different students could be working on them. When we make the match, students work with the city staff to bring these projects to fruition. Sometimes it involves, testing new ideas or sharing their deliverables with their stakeholders. And at the end of the year, we have something called a hubbub, where all of the students come together. Last year was held at Ottawa City Hall. The mayor was there, and actually was a Faculty of Medicine student who won the prize for the best project of the year. And that's just a way to celebrate the work that's happening across all the City Studio projects. So we usually have a number working across number of projects being completed across a number of different faculties. I think 6 different faculties in the Faculty of Medicine, in the University of Ottawa. Go ahead. These are a few examples of projects we've done in the faculty last year. So you can kind of have a look at them. We've had a lot of work done on stigma and substance use. We've had people working with the Ottawa paramedics on what's called their mental well-being response team, where we have now social workers and paramedics going out into the community to respond to low acuity 911 calls that involve mental health. So there's a number of different projects. We don't always know what they are, again, because they're coming from our partners, but hopefully we'll have a couple that you would be able to work on if that's something that interests you. Go to the next slide. I think another opportunity that we're kind of reframing and harnessing this year is to work with Let's Talk Science. There are probably people in the room, if you're from Ottawa, who've heard of Let's Talk Science or been involved. So essentially it's a STEM volunteer outreach organization. They have an amazing coordinator. They do hands-on curriculum aligned activities with students in schools and community organizations. They focus on youth from low socioeconomic areas, in particular with Indigenous youth, Black youth, and New Canadians. So there might be opportunities to be in person for these placements, which is great. Mostly in English, but there are bilingual and French options if that's of interest to certain students. And those will be other projects that are available. I know Christine knows a lot of that, and she's there in the room if you have questions. Go to the next slide. Great, that's it. This is our contact information. I can stay on for a couple minutes more, but please direct your questions to Christine. And again, sorry not to be with you. Sorry to have been summoned. And welcome to your programs.
Okay, if no one has questions, we'll move to the next presentation. If anyone has questions about Dr. Kendall's presentation, she could answer now, or Christine could also answer any questions related to City Studio or any of the activities that were shared. Okay, looks like we don't have questions. So please, Dr. Krentel, if you could. Thanks, Claire.
Great, thank you very much. Nice to see you all. How many in the room have heard of decolonizing global health? Just put your hand up. Okay, a few of you. Okay. So I'm going to just, in sort of 10 minutes or so, give you a kind of an overview of what this means and why it's important right now, and how it would affect your, if you decide to do the global health and social accountability concentration. So Manisha, and this has been really bothering me. I'm going to see if I can move this. I don't know if I can. There we go. That's been really bothering me. Okay. I don't know if that's better there or down. Maybe we'll put it down here. Okay. So Dr. Kulkarni already kind of covered this, so I'm not going to spend very much time here other than to say, you know, within the last 20 years or so, even more recent history than that, I would say, we're much more, you can see some of these major global contexts that have really pushed the agenda towards global health. You know, you will remember COVID-19, you will remember the Black Lives Matter movement, and you'll remember a lot of the things that have been going on in Canada with regards to the Truth and Reconciliation process here, and a lot of the activities that have happened in Canada towards that. So those kinds of things are happening in other countries and globally as well. And so we see there's been this shift in the way that we're thinking about global health. And I've put global public health out there. And if you're familiar with Professor Madhu Pai, who's at McGill, he refers now a lot to global public health. And there's a new PLOS journal, Global Public Health, which really encompasses this idea that we're really all connected to each other. So you'll see that sometimes now as well in the literature or in journals and things. So we're moving into a more systems approach, more partnership, as was said earlier, more aligned with health equity. By doing that, I may have messed something up. There we go. Okay, so we need to make some necessary shifts. We need to move from dualistic language, us and them, right? They need this. We need to help them. The way we manage our knowledge and data. This is really an interesting one if you're interested in doing research in global space. Our power imbalances, who holds the money? Who holds the say? Who holds the ethics? Shifting away from that into more equitable partnerships, bi-directional learning, where I learn from my partners in Ghana and they learn from me, that we share and we see the strengths that each brings to the partnership. Unlearning and relearning. This is really important. Thinking about where you are, your positionality in the world, and maybe some things that you've been taught or that you were part of your culture or your impressions about things, and thinking about those and going through a process of humility to say, what do I need to think about differently? What new perspectives do I need to bear in mind, particularly when you're working with different cultures and in different countries? We need to move away from these systems that have perpetuated a lot of dominance, and they're still there today. I'm not going to tell you that it's all global health is now transformed into being completely fair and equitable, because that would not be true, but we're trying. And so trying to push donors, trying to push partnerships, researchers that would be more equitable. So moving into this space where what we're doing is seen in a more holistic and systems way that's based on both fairness and reciprocity. And when you think about what Dr. Kulkarni presented, you know, it used to be I really only care about health in Kenya or health in Cambodia because I'm sending my troops there and they might get malaria. So I guess we better deal with that issue. So we've come a really long way, but we still need to continue the journey. And that's why the Faculty of Medicine in particular has put a lot of emphasis on this and will be part of your program. So what does it mean in research, for example? Where does your research idea come from? Do I, as a Canadian researcher, come in and say, I think you need to know about this? Or is this something that is brought up together? Is it co-created? Is it co-created with community? Is it co-created with researchers, with government in the countries where we're working? Closing the door on this idea of parachutes and parasites. I fly in, I get the data, I bring it home to Canada, I analyze it, and I publish my paper, right? There's big shifts away from that, as there should be. A renewed view of the way we disseminate research. Peer-reviewed papers and conferences in European or North American countries are not always accessible. In fact, they're not accessible to many of us and to many of you in the room, right? It's too expensive. But imagine if you're a researcher who has a limited or no travel budget. You can't get there. So thinking more about how we disseminate our research, also thinking about that knowledge translation piece. Who really needs to know? Do we need to also think about presenting back to community, presenting back to Ministry of Health, for example? So rethinking the way that we disseminate knowledge and research. And along with that, how we think about authorship. With the parachutes and parasites, Canadian author in the front, Canadian author in the back, because I need to get promotion, so there we go. We're moving away from that because we're recognizing the entire whole partnership that needs to go into that research and the value and the benefit that we have as working as a team. And so there's a real move, and some journals are really pushing this in order for us as researchers to really consider that broader participation than we've seen before. So what does it mean in terms of partnerships? Sharing the research dollars more fairly. Thinking about indirect funds, those funds that are taken in and making sure that those are shared with partners that we're working with in a global health context. What are the metrics of measurement for our partnerships? And there's some wonderful resources available that force us to think about how fair and equitable we're being in our partnerships. Agreeing on long-term goals, and the Faculty of Medicine is doing this with these partnerships that were shown to you earlier in Benin, Guyana, and Tanzania. By having an established partnership, it's not a quick fix where you go in and say, we're going to send some students this year, and then maybe next year we can't do it. But no, it's agreeing together, what do we want to do over the long term so that we bring value, and also you can bring value to us here at the Faculty of Medicine. What does it mean in education? So some of you will be familiar with medical teams that go in for 6 weeks, they do something, and then they go home. That's considered medical tourism. So we need to think carefully about the role that we play by coming as a clinician for 6 weeks, as coming as a researcher for 6 weeks, as coming for, you're doing a practicum, whatever it might be that you're doing. What's your impact on the country that you're visiting, on the partners that you're visiting, and really being sure that we're contributing to a much larger goal, and also that we're doing no harm while we're there, right? And making sure that we're adhering to those principles that are important for the country where we're visiting. We've talked about humility and cultural sensitivity. Who are the real experts in the room? And any of you who have ever traveled, you'll know that you get completely lost sometimes. You don't understand why you can't wear a certain pair of shoes, or why you can't wear a sleeveless shirt if you're a woman in Indonesia, or maybe why people don't shake hands, or why they do, or whatever it may be. We all get lost. And so who do we turn to? We turn to our partners to help us. And that expertise is so much deeper. It's how communities speak to each other, how you enter into communities, how people interpret disease, how they interpret the medical profession, et cetera. So we really, we need to be humble and be thinking culturally sensitive as well. So at the Faculty of Medicine, when we're thinking about decolonization, we're really thinking about these three areas: teaching and education, research, and partnership. I better wrap up. So in 2021, the Task Force on Fairness and Anti-Racism to Enhance Academic Leadership Partnerships, Education, and Global Health was launched, what we call FAIR. And you can get the full report there. This was launched as an initiative to understand how to operationalize the Brochet Declaration. And Dr. Kulkarni referenced that earlier. The Faculty of Medicine was the first in Canada to sign the Brochet Declaration, which was really important. And it really signals our commitment to ensuring that we live by the principles that are there. And so we asked ourselves the question, well, what does that mean? And what does that mean for our programs? These are just some of the representatives. Shows you kind of the breadth of the task force members. Our remit was to look into these three areas. And what's important that I'll mention here is we only looked at global health, i.e. what's outside of Canada. So what I'm talking about with regards to FAIR really applies to Faculty of Medicine work outside of Canada. In terms of education, what does this mean for us here? It aligned the redesign of pre-departure training, and so that has been done. So if you do choose to go on a study experience or a clinical experience abroad, you will have to go through the pre-departure clinical training through IGO, and that has been redesigned with the ideas of decolonization, fairness, anti-racism in mind. We try to involve partners early in the exchanges, which also helps you to have a better experience and them to have a better experience hosting you. I'm just going to highlight a few of these just for the sake of time. In terms of research, we provided some recommendations here. Those of you that are interested in research, I would highly recommend that you have a look at the old CCGHR, which is the Canadian Coalition for Global Health Research. They have a set of principles, and I would highly recommend that you familiarize yourself with those. In terms of partnership, these are just a few of the recommendations that were made as well to think about how our international exchange placements are carried out and brought forward. So finally, in terms of some general recommendations, where are we now? The FAIR recommendations have been presented, they've been accepted, and now in a process of trying to understand what the further operationalization of those recommendations mean. If you have any suggestions, I'm sure we'd be open to hear or observations as you go through the program, because it is meant to be an evergreen document and an evergreen process. So finally, this came from one of the reviewers who was based in one of our partner institutions, and it just reminds us that although many of the recommendations from the report are focused on the Faculty of Medicine here, we need to be mindful that we do not impose our changes onto our partners, but rather we must create structures and systems that allow for and expect an equal and fair dialogue and partnership with our partners. And so we need to be mindful of that as well as we move through this process of decolonizing global health. So with that, thank you very much.
Thank you, Alison. So I'm Leah Alcora. I'm the lead coordinator for global health. So in case you're interested to join the concentration in global health and social accountability, you'll be hearing a lot from me and from our office and from the Office of Social Accountability. So I'm going to show you a video that kind of explains the concentration in global health and social accountability and that opportunity in case you're interested to register. It's just a 2-minute video, so.
Welcome to the University of Ottawa's concentration in global health and social accountability. where learning extends beyond the classroom to make a meaningful impact on health and well-being. Open to all faculty of medicine learners. This concentration offers a unique blend of experiential learning activities tailored to your interests. We've expanded our focus to include social accountability, planetary health, and indigenous health.
So, why participate? By joining the concentration, you'll dive deep into diverse global health and social accountability issues, connect with like-minded peers and professionals, and gain valuable skills for your future career. The format is dynamic, emphasizing participation in experiential learning activities while providing resources for optional self-directed learning. You have the flexibility to complete the concentration over 1 to 4 years, allowing you to tailor your journey to your own pace and preferences. Assessments are both qualitative and quantitative. Reflect on your experiences with brief written reflections, and earn points based on activity duration. This points system ensures a fair and rewarding assessment process. We've streamlined the process through Brightspace. Log into your account, select the course, Concentration in Global Health and Social Accountability, and start logging your activities and submitting reflections. Reflections are a crucial aspect of your journey. For most activities, a 250-word reflection is requested, showcasing your thoughtful engagement. Longer reflections are expected for global health placements and 20-hour experiences. Have a unique activity in mind? Submit a special request form on Brightspace for pre-approval or retroactive consideration. Your individual experiences matter to us. Reach a minimum of 50 points, including reflections, and you'll receive a certificate of achievement, a testament to your commitment to global health and social accountability. Join us on this transformative journey. Visit our webpage for a list of eligible activities, and feel free to reach out if you have any questions.
So just some highlights. This concentration is open to all Faculty of Medicine learners. You can build your own experience and your own path. You don't have to follow a specific program. It's actually an add-on to your experience, your learning experience, and also to your career and your CV. It's quite easy to reach the 50 points. You'll get to meet different student ambassadors who either completed their concentration or are in process of completing their concentration. And most importantly, if it helps you develop skills, learn more about global health and social accountability, and learn outside the classroom. So some of the activities that we organize, one of them is today. For example, you could submit a reflection on your experience today in this session and gain points towards your concentration. You could also join the different events that the IGO office or the Office of Social Accountability plans. We usually share these by email and on our social media and website. And you could register for these events, and you could also use your own experience if you're, for example, you've done an elective in another country, or you're doing an MPH placement or a practicum, or you're also working with a specific student group on a particular activity. We could also take that into consideration, and once you submit a reflection, we might have questions, but we could also allocate points for your own experiences, like in Let's Talk Science, or if you're interested in particular climate events, or planetary health, or global health. Also, you've seen the presentation of Dr. Kendall about the Empathy Project and the climate risk. So these, about the Empathy Project and the City Studio projects, these are also opportunities that you could consider in your concentration. So some activities also are student-led, and that's where you would hear from the student ambassadors who are leading on a Global Health Journal, who are working on Global Health student events where students highlight their own experiences, and all these events would help you into collecting points towards your concentration. We also organize a Global Health Learning Network where we have different events and we advertise them beforehand. if you are interested to register in the concentration, this is the QR code, and we'll also be sharing the slides on the Bright Space. And if after this session you're also interested in joining similar events like the one we're doing today, we have a very interesting event on October 23rd. It's a global health human library where you'll get to meet 7 experts from different leading institutions in global health. So I strongly encourage you to register. It will be a unique opportunity for you to meet experts, to get to meet them in person, ask questions, see their career path. So if you're interested to register, you could use this QR code too. Now I'd like to introduce you to one of the student ambassadors who managed to be here in person, Aya, but you'll also hear from other students who sent us their videos because they were unable to join today. So Aya, the floor is yours. Yeah.
Okay, I won't speak too long. My name is Aya. I'm in my 4th year of my undergraduate program in TMM. But as Leah said, if you're in the Faculty of Medicine, you're able to complete the concentration. So I'm still ongoing in my concentration, but one of my favorite activities was just recently completing the empathy project. It's also important to reflect on the experiences that you've already completed, as you can gain points for those. As long as you've contributed to your community in some way, you've taken away some experiences from that, it's always possible to relate your concentration points to those experiences. So one of the things that I do every year is volunteer at the butterfly, little greenhouse at Carleton. And that's something you can gain points for because it's with Let's Talk Science. So really the possibilities are endless, and it's such a great opportunity to take part in.
Thanks, Aya. You get to meet Julien as well, but through a video.
Hello, my name is Joignez Turk. I'm a 3rd-year medical student here at the University of Ottawa, enrolled in the French stream. I've been enrolled in the concentration in global health since my first year here at U Ottawa, and this year I'm really happy to be a student ambassador for the program and be your voice at IGO. A little bit about myself: I've been interested in global health for some time. My interests have been pretty varied, and it's brought me to the Yukon in my first year, most recently to Tanzania, and then to Oman this summer, as well as to participating in various courses offered through IGO, such as Cascades and the McGill Institute for Global Health as well. So I'm really happy to be an ambassador this year and hope to hear from many of you and hope to connect with you all soon. Thank you.
Okay, there's Mahalakshmi, who actually sent a short presentation on her path. So I'm going just to run an audio.
Hi everyone, my name is Mahalakshmi, and today I will be briefly talking about my journey in global health and social accountability concentration. Hi everyone. Currently, I'm a 2nd-year student in MPH policy program. So the first year I was interested in both public health policy as well as global health, but I ended up choosing policy as my stream. So in order to gain experience in global health, I chose to do this concentration and be able to follow my passion for both policy and global health. And I joined the concentration during my first semester, so last fall. And as part of the concentration, I've participated in a couple of events that's hosted regularly. And one of the events that stood out to me was the Empathy Project, specifically focusing on experiencing homelessness. So it played a crucial role in deepening my understanding of the challenges people encounter when they're trying to meet basic needs such as getting access to food, housing, legal aid, etc. So essentially, we were role playing their role in a given day and simulating their experience as an individual experiencing homelessness. And in addition to this, I also took the Global Health Epidemiology course this winter, and this further deepened my interest in the subject, and it led me to pursue this ambassador position as a global health student. Currently,
Okay, the last ambassador is Lena. So she also sent a video.
Hello, my name is Lena, and I am one of the Global Health Ambassadors for this year. I'm also a third-year medical student in the French stream, and I'm just hopping on here to kind of introduce myself and tell you my journey throughout the concentration. So I had the opportunity to do a couple of international placements in Egypt. Both of them were in Egypt. I was able to do a research and a clinical placement. I also had the opportunity to participate in a lot of the in-person events that take place through the Global Health Office. And I was also the VP Global Health for the Sculpion Society last year. And those were kind of my contributions to global health at the school. In my free time, I like to cook and I like to paint, and I'm looking forward to working and hearing your stories over the next year or so. So please reach out if you have any questions, and I'd be happy to chat.
Okay, so if you'd like, we have Aya with us, who you could get in touch with, one of the student ambassadors. But if you manage to register for the concentration, you'll have the contact details of all student ambassadors on the bright space of the concentration. If you have any questions related to global health or social accountability, please feel free to reach out to us. These are our contact details. You can find most of the information that was shared. We'll have a recording of the session on the bright space of the concentration too. And if you have any questions related to global health and your global health journey, please feel free to email us on IGOMED. Thanks for joining.